Hello, my name is Pedro Fayoni, and I'm going to talk about the acetazolamide in lithium induced nephrogenic diabetes insipidus. For the definition, we have that the diabetes insipidus is a rare condition in which patients excrete large quantities of diluted urine, in this case up to 1 liter per hour in the most severe cases, leading to the dehydration in the absence of the adequate water intake. It can be either central, resulting from failure to synthesize or secrete vasopressin from the hypothalamus or posterior pituitary, or it could be nephrogenic, resulting from kidney inability to respond to vasopressin. Nephrogenic diabetes insipidus can result from genetic causes such as mutations in the B2 vasopressin receptor of the or the accompanying 2 water channel, or acquired causes such as lithium therapy. The latter is the most common form of nephrogenic diabetes insipidus and is known as lithium-induced nephrogenic diabetes insipidus. Lithium enters cells through several transporters, but there is limited transportation out of cells, resulting in intracellular accumulation.
So now we're going to look at diabetes insipidus, right? So just like before with diabetes, the common symptoms is polydipsia. So this is excessive thirst. Polyphagia. Polyphagia is excessive hunger. And polyuria, right? Excessive urination. Now, when we look at the different types of diabetes insipidus, right? So diabetes insipidus is an abnormality of the ADH hormone, right? So ADH hormone was the antidiuretic hormone. Main function of an antidiuretic hormone. So if you can't remember that, think about what does a diuretic do? A diuretic makes you pee. So what does the antidiuretic hormone do? Stops the pee, right? So it's water retention. So ADH is one of the central factors of majority of these different types of diabetes insipidus that I'm going to talk about. So this is water retention. So this is also called vasopressin. So vasopressin is another name for antidiuretic hormone. So antivasopressin is a diuretic. Okay? Right. So here we have the different types, and if you remember from before, where is ADH created? So ADH is created in the hypothalamus, and it's stored in the posterior pituitary. There's 4 different types. So number 1, this is the central diabetes insipidus. This is where there is a lack of antidiuretic hormone present. So due to some kind of congenital abnormality where the ADH is not produced in the hypothalamus, and so you have no antidiuretic hormone, so you lose the ability to retain water. Okay? So number 2, you have nephrogenic. So nephrogenic, so whenever the ADH is released, it migrates all the way to the renal system where it binds to the collecting duct. And at the collecting duct, it allows for these aquaporins to open and allow for the permeability of the water. All right, so this is nephrogenic. So there is a defect in the region of the collecting duct where there is some kind of abnormality where the antidiuretic hormone, even though it's present, cannot actually function when it reaches the site of location.
Applications in medicine. Acetazolamide might be an option to treat lithium-induced nephrogenic diabetes insipidus patients who fail to respond to standard treatment. The use of acetazolamide in lithium-induced nephrogenic diabetes insipidus must be monitored, including its effects on glomerular filtration rate. Following treatment with acetazolamide, daily urine output decreased, urinary osmolality increased, and observed sodium levels normalized. No major adverse effects were observed.
Hello everyone. Today I wanted to talk about a rare but clinically significant side effect for lithium. Lithium is a medication that's used for bipolar disorders and other indications. And this side effect is called diabetes insipidus. Diabetes insipidus, in other words, is the kidneys will not be responding to the antidiuretic hormone that's released from the brain. What does this mean? Antidiuretic, if it's not responding to an antidiuretic hormone, this means diuresis, right? And the patient will pee lots of urine. And based on that, patients, in order to supplement the lost water, a patient has to drink lots of water. And it can go unnoticed for years and years, because if the patient drinks lots of water, nothing will happen. However, if the patient gets admitted to a hospital with restricted fluid intake, and this might lead to loss of lots of fluid, and serum sodium goes up, maybe even in 24 hours, from like the 130s up to 160s, and results in adverse consequences. One of the important things too, so it's the role of the pharmacist, we need to look into that, the history of lithium and diabetes insipidus.
Pros and cons. In pros, we have acetazolamide might be an option to treat lithium-induced nephrogenic diabetes insipidus patients who fail to respond to standard treatment, a progressive reduction of the urinary output and decrease in serum sodium and a reduction of serum osmolality. In cons, we have that it is a new treatment, so there is a lot of study and investigate.
Welcome back. Today we'll talk about diabetic insipidus. Diabetic insipidus refers to ineffective antidiuretic hormone, which results in inability to concentrate urine. ADH is secreted from the hypothalamus, so if the secretion is decreased, we call this central diabetic insipidus. And it works in the kidneys, so if the receptors are defective in the kidneys, we call this nephrogenic diabetic insipidus. The cause for central diabetic insipidus is basically anything that can damage the brain and decrease the secretion of ADH. The diagnosis is basically made by imaging studies where we see damaged brain, or by administering ADH and reversing the pathophysiology of central diabetic insipidus. In other words, if administration of ADH results in concentrated urine, this is the central type. The treatment is ADH analogs and hydration. Nephrogenic type is caused by damage to the receptor of ADH, which can be caused by hereditary receptor mutation or medications such as lithium. The diagnosis of nephrogenic type is made when the administration of ADH does not result in urine concentration. The treatment of the nephrogenic type is a little bit tricky, so I'm going to try explaining each medication as we go on so you can memorize them better. Thiazides are used because even though they are diuretics, they cause concentrated urine. NSAIDs are used because they break prostaglandin, which normally breaks ADH. So NSAIDs salvage whatever ADH we have left. Amiloride is especially effective in lithium-induced diabetic insipidus. And it doesn't hurt to give hydration and salt restriction.
Issue applied in Ecuador. The problem to be solved in Ecuador would be to train the doctors to be able to treat this disease and have the correct medication that has the least adverse effect rate, such as acetazolamide.
Good morning everyone and welcome back. Today we're going to be talking about acetazolamide. Acetazolamide works by inhibiting the renal enzyme carbonic anhydrase, which normally functions to reabsorb bicarbonate. So it depletes the body bicarbonate and causes temporary metabolic acidosis. We can use it to alkalize the urine, because the urine will have a lot of bicarbonate that we did not observe. And note that alkalization of urine will treat aspirin overdose. It's also used for altitude sickness, and it's the medical treatment for pseudotumor cerebri, which is a syndrome caused by symptoms of increased intracranial pressure with no obvious mass or lesion. If medical therapy with acetazolamide doesn't work, we can go for surgery, and the procedure is called optic nerve fenestration. And it's also used for glaucoma. It causes sulfa allergy like many diuretics. It also causes ammonia toxicity and metabolic acidosis. Here's a small quiz. So, which of the following
For the last, the conclusion, Ruth and co-workers recently published a series of mice and 6 human patients with this syndrome. 2 patients withdrew from the study due to side effects. In the remaining patients, acetazolamide did not increase urine osmolality or decrease urine output significantly. In mice, acetazolamide partially reversed lithium-induced polyuria and increased urine osmolality. The decrease in urine output in mice was associated to the decreased glomerular filtration rate, which warrants against acetazolamide application in first line without further studies. Thank you.